The average wait time in some areas of the country for a primary care visit, even in your network, is 28 days. Retail clinics, you can go on CVS or Walgreens' app tomorrow, and if there is one near you, you can probably get an appointment in 24 hours.
Hey gang, it's Tuesday, August 17th. Rajiv and listeners, welcome to the Behind the Numbers Daily and eMarketer podcast made possible by Vtex. I'm Marcus, and today I'm joined by one of our digital health analysts. It's Rajiv Leventhal.
Hey Marcus, thanks for having me. Really excited to be here today.
Of course. Thank you so much for hanging out. So today's fact, before we get started, the placebo effect still works when you know you took a placebo. This is insane. So scientists have found that the placebo effect does not have to rely on the person not realizing they've taken a placebo. So there's a study from Harvard University and the University of Basel, and they found that those who unknowingly took a placebo are supposed to relieve pain, and those who knowingly received the dummy drug both showed relief from pain. So if you know you're taking it, it still has the same effect. It's insane, isn't it? The mind. What a crazy place.
The placebo effect is strong and it's real.
It's very real. It's too real. So there's also two other things I was reading about. I didn't do anything today. I just read about this. Both from Walden University. So one is, evidence suggests that the more dramatic a fake treatment, the better it works. So for example, if you take two placebo pills, it's going to be more effective than one. And, also from the Walden University, the placebo effect has a less researched but still powerful opposite, the nocebo effect. It's a real thing. If you're told a treatment can have a negative side effect, we're more likely to experience that side effect, even if the treatment isn't real. Oh man, I need to lie down. It's a lot to take in.
I'm going to stick with fewer the pills if possible.
It's probably a good idea, yeah. Yeah, that's sound advice. Anyway, today's real topic, why and how retail healthcare could be poised to change how primary care is delivered. So Rajiv, we're talking about retail healthcare today. What is it? What does the landscape look like? How is it being disrupted? What do people want from retail healthcare? And what's the virtual component all about? But let's start with what the devil retail healthcare even is. Do you want to hit us with some form of a definition?
Yeah, so the concept of retail healthcare has been around for years, but it's been emerging even more so in recent years. And what they're basically retail health clinics, and they're health centers located inside the stores of your retail giants like CVS and Walgreens. And these clinics come in different shapes and sizes depending on who the retailer is that we're talking about, but they're usually located in the back of a store by the pharmacy. And for the most part, they focus on low acuity services like minor colds or a rash or to do immunizations, things like that. And they serve as sort of an alternative to urgent care and primary care. And they're growing just in terms of physical footprint, but I'd say they're still pretty immature in terms of how many of them there are and how many patients, consumers visit them on a daily, weekly basis.
So that's an excellent definition. And let's talk about how those retail clinic patients stack up against some of the more familiar forms of care, primary care, urgent care, things like that. So we have some numbers on all of these. Primary care physician patients in the US, primary care physician patients, about 60% of the population is in that category, primary care physician patients. Then you have about 38% of the country that visits urgent care patients, and then about 26%, if we're rounding up, retail clinic patients. So 60% for primary care, 38% for urgent, and 26% for retail clinics. So it's in the third place, Rajiv, compared to these two. It is growing, but surprisingly, it's not growing as much as you would have thought, given the amount of investment that we're seeing in this space. 67 million folks, that 26% translates into, but not going up by much at all, at least next year. Who knows about the years beyond? Our forecast only covers next year. What's going on there?
Well, there's some overlap in the categories that you mentioned. Of course, some will go to primary care, will also go to urgent care, and they'll also go to retail clinics. And it might depend on what condition they're looking to get treated or just what their situation is, how quickly they might need an appointment. We can get into some of those consumer expectations a little later. But Yeah, I would say, for now, the reason why you might not see massive growth in the retail clinic market is there's not a huge physical footprint. So your leaders in this space are CVS and Walgreens, and CVS has, tons of retail stores, of course, all over the country. I think they have 10,000 retail locations, but they might only have 1,000 or so of these minute clinics, of what they're called, and they're building these health hubs, which are a little more advanced, but there's not many of those yet. Walgreens has 400 or so clinics compared to 9,000 plus retail stores. So there might not be accessibility and availability in some areas of the country, probably more particularly in Midwest, rural areas. So for those people, instead of going 50 miles to go to a retail clinic, they might just wait a few days and go to their primary care doctor or find an urgent care clinic appointment the next day. So I still think it's an unorthodox concept to some, getting healthcare at a retail store, and that might be inhibiting some growth as well. But we do estimate that about 67 million U.S. consumers will visit a walk-in retail health clinic in 2021, about 25% of the adult population. I would expect that number to get a lot bigger in 5 to 10 years, but in the next year or so, yeah, probably not.
Yeah. I mean, 2019, it was 53 million. So we've grown 12 million from just 2 years ago. So the numbers are going up. As a share of the population from that 26%, it's not going to go up too much going forward, but still, you could argue relatively early days. Before we get into some of the folks who offer these types of services, you mentioned Walgreens and CVS already. We were talking about why people might visit a retail health clinic. What do people want from a retail health clinic that they may not be able to get elsewhere? Or if they can, why are they prioritizing retail health versus going somewhere else?
Well, Marcus, it's convenience and it's access. So my primary care doctor is, just for a personal situation, is available Tuesdays through Thursdays from 9:30 to 3:30. Well, a retail health clinic is available 7 days a week from 7 a.m. to 7 p.m., for example. So 48% of retail clinic visits, according to research that I saw, occurs outside regular office hours. So that means that not in the 9 to 5 window where typical doctor, primary care visits occur. The other thing is the wait time. So the average, this might blow your mind, the average wait time in some areas of the country for a primary care visit, even in your network, is 28 days. Retail clinics.
What?
You can go on CVS or Walgreens' app tomorrow, and if there is one near you, you can probably get an appointment in 24 hours. So that is a big factor as well for why consumers might want a retail clinic. And again, it is only for certain conditions, lower acuity type conditions, a throat culture, a nasal swab, an immunization. But there are real convenience and access issues in the primary care landscape that, your incumbents are dealing with, and it's frustrating consumers.
Yeah, there's some shocking numbers. So, really quickly, before we move on to the players in the space, where are these retail healthcare patients coming from then? You mentioned the primary care clinics and the fact that the office hours are a lot more constrained, but are they mainly coming from that space? Is it urgent care folks who can quickly get to some of these locations versus urgent care facilities?
Yeah, it's really a mix of people, and it kind of depends on where these clinics are located. A lot of the people who visit these clinics tend to be younger. They're located in areas with high density of healthcare resources and without a primary care physician. So that definitely contributes to the population of people who are going to these clinics.
Mm-hmm. There was a really interesting stat that you had pulled into one of your articles talking about Walgreens and them doubling down on primary care. You said 6 out of 10 US adults were living with at least one chronic condition. 6 out of 10 living with at least one chronic condition requiring multiple daily medications and more frequent checkups as well. So there's a lot of folks out there who do need that access and that convenience that you were talking about. You already mentioned Walgreens and CVS as well. What other players are in the retail healthcare space? And if you had to rank them, who is the giant in the space? Who's first, second, third, roughly?
Yeah, so those are the two big ones, CVS and Walgreens. And if you kind of look at the recent dealings with those two retail giants, it's kind of like, what can I do to beat you? Keeping up with the Joneses type situation with CVS and Walgreens. They're definitely leading the pack. CVS, as I mentioned, they have 1,000 or so minute clinics that are open. They're opening more of these health hubs by the end of the year. Walgreens, it's interesting. They invested $1 billion last year into this primary care startup company called Village MD. And through that partnership, they're opening up 600 or 700 of what they call Village Medical at Walgreens clinics inside Walgreens stores over the next 4 years. And some of them exist now, but they're mostly future forward. Who else? Walmart, their initial plan, they were in this space. They said they were going to open up 4,000 the next 10 years, but the pandemic and some other reasons have scaled that back. So now they're saying we're going to open, several dozen by the end of the year, but certainly ambitious plans might be scaled back a little bit. And how about this? Dollar General is not in the healthcare or even pharmacy space yet, but 75% of people in the U.S. live within 5 miles of a Dollar General. That's more people than the number who live within 10 miles of a Walgreens. So while that's
shocking statistic,
you don't think of Dollar General because they're not in healthcare yet, but it's possible that they could get there just based on their footprint and how many people live so close by.
Yeah, you hear Dollar General and your first, at least my first thought was, huh? And then you hear that statistic and you think, of course, that makes the most sense if everyone lives next door to one.
And what's interesting, Mark, is they just hired a chief medical officer. So they're not even in the pharmacy space yet. They're kind of just working on boosting up their healthcare and wellness products, but it's something to keep an eye on.
Yes, absolutely. Ria Patel, one of your colleagues, Insider Intelligence research analyst, noting that they have unique access to rural communities as well. So unique selling point there. We talked about Walgreens and their plan to open 600-700 Village Medical clinics over the next 4 years or so. Rajiv, you noted that Walgreens is banking on a key element to set it apart. Its clinics employ board-certified doctors required by Village MD. What does this mean and how is this different from what other folks are doing?
Yeah, this is an interesting thing that I'm not sure the average consumer might even care to look at. But Walgreens, based on this partnership with Village MD, this primary care company, they recruit doctors, board-certified doctors that will be staffed inside these Walgreens clinics, whereas the CVSs have and the Walmarts have nurse practitioners and physician assistants. So that could give Walgreens a leg up. The fact that they're working with Village MD, they've invested a lot of money into them to go out and recruit these doctors and provide really a full-scale primary care service infrastructure that, CVS and Walmart don't quite have. So it's really interesting to see how, their strategies are pitted against CVS's who don't have those board-certified docs.
Right. So, yeah, it's a clinic here and a clinic there, but the types of physicians at those clinics can differ quite drastically. How are retailers disrupting healthcare, Ranjiv? I mean, we talked about building more clinics, but how else are they really shaking up the space?
Yeah, well, we talked about the consumer angle, looking at it from the retailer side. They're thinking that they can add healthcare services that could attract shoppers who might be front of the store shoppers, but they might need to pick up something from the pharmacy that's located in the back of the store where these clinics are. And you mentioned how many patients or how many people have chronic conditions. Well, 130 million or so of people are on prescription medication. So imagine a model, right, for a Walgreens or CVS, and they're saying, well, come pick up your shampoo, your dish detergent, your medication as you normally do, and maybe you'll get a rash looked at, or maybe you'll get a throat culture done rather than schedule a separate primary care visit. When you leave the store, you can get everything done in a one-stop shop pharmacy primary care sort of integrated model. It's pretty cool. It's pretty interesting. Another way they're disrupting is transparent pricing, right? If you go to your primary care doctor, maybe you have a high deductible health plan, so you know that you're going to pay a good amount out of pocket at first, or you might not even have insurance at all. You don't know what your service is going to cost, right? But you go on Walgreens or CVS's website, sometimes they even actually have these signs in stores. They'll say, well, a cholesterol screening might be $89, and this checkup and your annual physical might be $109, and that's been shown to be 30 or 40% cheaper than what it might cost at a primary care physician. And you're not even going to know at the PCP. You're not even going to know what that bill looks like until after you leave. So that upfront transparent pricing is something that these retail clinics are banking on too.
A great point. Well, what kind of virtual care is being offered by these retailers? We've seen an explosion in virtual care because of the pandemic, but are they also interested in this space or more so in the physical presences of their clinics?
Yeah, so they all have virtual care options, which of course appeal to patients because they want the flexibility of booking an in-person visit or a virtual one if they can't get there. So CVS works with this company called Teladoc. They're one of the biggest, if not the biggest, telehealth player in this space. And they actually just 2 days ago, good timing, the two of them, CVS and Teladoc, rolled out this virtual care only primary care plan. And it's only going to self-funded employers right now. But it's important because CVS, of course, acquired Aetna, one of the biggest payers in this landscape, a couple of years ago. So they have a leg up by reaching out to all of Aetna's members. Walmart acquired a telehealth company called MeMD earlier this year. So to answer your question, all of them are going into the virtual care options. They have them now. You can go on the app and say, I want a virtual care visit instead of a in-person one. And it might depend on which telehealth company they work with, but virtual care is a huge, huge part of this. We saw over the pandemic how patients, look towards virtual more now than ever before. And the satisfaction rates are high for certain conditions that these clinics will treat. A lot of patients will say, yeah, I'd rather have a telehealth visit.
Right. And at the very least, having that option, right?
Yeah.
Erin Ahmed's digital health analyst at Insider Intelligence was noting many consumers will likely prefer the flexibility to choose between in-person and virtual care when needed.
That's right.
According to Amwell's 2020 Physician and Consumer Survey. You touched on this, Rajiv, a bit earlier, but Walmart, the fact that they've decided to greatly decelerate their very ambitious clinic growth plans. So you mentioned they're planning to build 4,000 by 2029. So that's 500 a year for the next 8 years is what their plan was. That's 1.5 new Walmart clinics every day for the next 8 years. And they really, they slammed on the brakes on that initiative. And as you said, they're still going to roll out some, but way, way less. Why is that?
Yeah, Insider reported last month that those plans are going to be scaled back. Well, this might not be specific to Walmart markets, but healthcare is hard for non-traditional players to enter. Delivering care is really difficult. It's expensive. You have to deal with insurance companies. You have to get providers on board. You have to gain consumer trust. And we have seen over and over, going back a couple of decades even, when non-traditional players come into healthcare, they very often fail. And maybe when it comes to technology, they'll be more likely to succeed. But when it comes to administering care, there are a lot of barriers. And I would guarantee that those are some of the reasons why the Walmart plans are being scaled back.
Yeah. You mentioned the MeMD Walmart deal, the fact that Walmart bought telehealth provider MeMD, that gives them an existing customer base, which is good. But it also, speaking to yourself and Lisa, our principal analyst in healthcare, talking about this, the fact that telemental health services are growing rapidly. So not just telehealth, can you look at my arm through the camera and see if I'm doing okay, but also therapy sessions and things like that as a growing space.
Yeah, and behavioral health, Marcus, is something that's such a natural fit with telehealth because, a lot of patients with behavioral conditions might actually feel more in their natural environment on a screen, on a computer setting than in a face-to-face one where they might be a little bit more anxious and things like that. And behavioral health specialists have come out and said that's the feedback they're getting. And if you look at the telehealth visit, kind of the trend since, say, maybe late last year, it's declining. But the behavioral telehealth visits are actually maintaining status quo, whereas the clinical side is declining, which makes sense, of course, as doctors' offices open back up.
Yeah, very interesting indeed. That's it for the first half of the show. It's time now for the halftime report, where we summarize the key takeaways from the lead story in about 30 seconds or so. So, Rajiv, your takeaways from the first half would be?
Yeah, I think it's a really interesting space to watch, the retail health clinic space. But one interesting area to look towards the future is it comes down to accessibility versus trust, because no matter how much we talk about the frustrations with primary care wait times and things like that, all the data points to everybody, 98% of consumers still trust their primary care physician over anybody else, including a retail health clinic. So that is where I would say retail health has a ways to go in terms of gaining that consumer trust expanding that physical footprint, because until they do, I do think your primary care physician with a patient trust will win out.
Well, that's all we have time for the lead story. Unfortunately, we say goodbye to Rajiv. He's just joining us for the first half. Thank you so much for hanging out with us, fella.
All right. Thanks so much. This was fun.
Absolutely. It's time now for In Other News, but first a quick word from our sponsor, Vtex. Retail's next competitive threat may come from a business model or channel that didn't even exist a few months ago. This modern dynamic requires companies to adapt quickly, pivoting business seemingly overnight, something traditional commerce platforms just can't support. There's a new enterprise commerce platform on the rise, one that's fast, flexible, and doesn't require 9 months and $1 million to get up and running. Go to Vtex, vtex.com/eMarketer to learn more. All right, folks, we are back. It's time now for In Other News. Today, we are joined by our principal analyst who covers everything TV and video. It's Paul Verna.
Great to be here.
Hello, sir. Thanks for hanging out with us. Today, in Other News, how much time do people spend on TV and streaming? Peacock needs to figure out what's next. And Hulu is adding 2 big channels for football coverage. Story 1. Nearly a third of waking hours for British adults are spent on TV and streaming. Nearly a third of waking hours, notes the UK regulator Ofcom. BBC tech reporter Jane Wakefield notes that screen time spurred on by pandemic lockdowns was a daily average of 5 hours and 40 minutes. That's up 47 minutes on the previous year. She also notes 2 other interesting points. 1, for the first time, more households had a Netflix subscription than a paid TV account, cable, satellite. And number 2, nearly 8 out of 10 households now have their TVs connected to the internet. Paul, what do you make of these numbers, and how do things look over here across the pond in America?
Well, the first thing that struck me about those numbers is how closely they track with our forecast for U.S. average time spent with TV and digital video. So the total of both of those in 2020, in the U.S., 5 hours and 53 minutes of time with TV and video. That was up quite a bit from the year before. So again, pandemic driven. And then it's expected to trend downward in the total sense, but obviously upward with video and downward with TV. So interesting figures. When you read a third of waking hours, it sounds like a startling amount of time, and it is, but it is very consistent with what we're seeing on this side of the pond.
Mm-hmm. Yeah, breaking down those American numbers a bit further, Americans will spend 3 hours and 15 minutes watching TV every day. On average, this year, Paul's numbers were for last year, referencing the study, which was 2020 as well. But for this year, 3 hours, 15 minutes of TV time for Americans per day. Next year, it's 3 hours. So as Paul mentioned, it is going down. And Americans will spend just over 2 hours and 30 minutes watching digital video per day on average this year. Next year, it goes up to 240, so it jumps 10 minutes. Story 2. With the Olympics over, NBC Universal's streaming service Peacock needs to figure out what's next, writes Katie Heck of The Verge. She notes that because Peacock's coverage of the Tokyo Games was wonky and confusing, the platform hasn't given viewers much of a reason to stick around. Paul, what is next for Peacock? Where does it go from here?
Yeah, I totally agree with the user experience on Peacock, and I think we have talked about this before. I'm one of many who found the experience to be lacking when it comes to the Olympics coverage. I think it would have been acceptable or maybe more expected if this had been last year, because Peacock was supposed to launch around the time of the 2020 Olympics before they got rescheduled. So if they had had these sorts of issues, launch issues, maybe it could have been expected or I guess forgiven. But a year on with Peacock in the market, I think they really missed the ball with the Olympics. And I think it does beg the question of what happens next. Now, they do have some interesting, sports rights, but in general, they're not a streaming service that is investing in content specific to that service. So really, it's more of an offshoot of NBC Universal, the broadcast network. And it remains to be seen whether that kind of approach is sustainable.
Yes. Richard Broughton, a research director at Ampere Analysis, was saying that, does that NBC type content strategy, it could attract subscribers to the service's free and ad-supported tier, not necessarily to its premium offering. Peacock's future, you talked about some of their sports rights, their future programming slate does include the 2022 Beijing Winter Olympics and Monday Night Football, some originals, the streaming rights to Universal films after they debut in theaters from 2022. So there's some stuff in there, but maybe not as strong as some of the other platforms. In their Q2 earnings call, Comcast said Peacock had 54 million signups and over 20 million active accounts as of the end of July, just over a year after launch. We don't know how many of those are paid. Story 3. Miss Heck of The Verge also recently wrote that Hulu is adding 2 big channels for football coverage to its live TV service. The NFL Network is now being included in Hulu's live TV package for free, featuring studio coverage, original series, live NFL regular season, and preseason games. The NFL Network will join over 75 live TV channels that make up Hulu's live TV package that runs $65 a month. The other offering they're putting out there is NFL Red Zone, which will be part of a new $10 a month sports add-on. So, Paul, which streaming platform do you think is winning the sports rights battle thus far?
Well, I think when you look at the live TV services like YouTube TV and Hulu with Live TV and Sling TV, it's really a toss-up. I mean, this is an interesting win for YouTube, but it's not going to necessarily mean that they are the leader in sports. So I really see these live TV streaming services as all having, and by the way, I should add Fubo TV, especially as they're kind of a sports-centric service. But I think they all have interesting licensing deals, and it really comes down to, if you're a sports fan, how does each service align with what you want to see? You know, if you're a football fan or a basketball fan, you know, is it college or professional? Or if you're a soccer fan, which specific, say, European league are you gravitating towards? So all of those decisions will weigh in on which service is in the lead. But I will also say, if I can just give a little more nuance to the answer, that when I look across the whole landscape, the company that really stands out for me is Amazon, because not only have they leapfrogged their digital media competitors like Facebook, Twitter, and YouTube when it comes to live sports game content, but they also now are really going toe-to-toe with the big network, you know, the big broadcasters when it comes to licensing sports. They're not at that point yet, but it reminds me a little bit of where Netflix was maybe 2 or 3 years after they started streaming, and they were getting attention for some of their original content with awards and things like that. So at the time, Netflix was still sort of a niche, but it didn't take long for them to become an established TV provider or even film studio. And I think Amazon is on a similar trajectory when it comes to sports. I think within 2, 3, 4, 5 years, we're going to be talking about Amazon right alongside ESPN and all of the other streaming services and TV networks that are in the mainstream of sports broadcasting.
Excellent points as always, sir. Thank you so much for hanging out, Paul.
Always a pleasure. Thank you.
Thanks to Victoria, who edits the show. Thanks to everyone listening. August 19th, this coming Thursday, you can check out our one-on-one with Axiom, talking about the age of ethical customer experience with Chief Client Officer Tate Ollinghouse. Nicole Perrin will see you tomorrow for one of her final ad platform shows, an eMarketer podcast made possible by Vtex.